Good afternoon and welcome to MOAA's December webinar addressing a year of changes in veterans and survivor benefits. I'm Jim Carmen, MOAA's Vice President for Member Support. The last few years have seen many changes in veterans benefits, and in the constituencies the Department of Veterans Affairs is called to serve. 12% of our nation's 22 million veterans are now female. In 1975, there were 2 million veterans over age 65. Today, there are more than 10 million veterans over 65. The VA budget is up 90% in recent years, and it is the second largest operating budget in the federal government, trailing only the Department of Defense. And successive secretaries of Veterans Affairs under two different presidents have worked hard to change the culture at VA from a rules-based system to a principles-based system built around improved customer service. Today's program will update you on many of these changes, and it's part of MOAA's commitment to deliver value-added information and services to the entire military community. In addition to our award-winning advocacy work on behalf of our nation's military and veterans, we also have practice areas focused on retirement planning and financial management, including the new blended retirement system, career transition support as you prepare for your first civilian job or for a move to a better job, military caregiver support, and award-winning college scholarships and military professional development programs. I hope you agree this is an impactful association doing important work for all 350,000 of our members and even for the entire military community. Moreover, I hope you will consider the benefits of supporting our important work through a MOAA Premium or Life membership. It's really an investment to safeguard your hard-earned veterans benefits. Whether you're currently serving on active duty, in the Guard or Reserve, a surviving spouse, retiree, or a military family member, MOAA is working for you every day to support your interests before Congress and the executive branch, and we would be grateful for your support. With that, let me turn the mic over to my colleague, Paul Frost. Paul is a credentialed financial counselor and an accredited veteran service officer. He will guide us through these changes and lead our discussion today. Thank you very much for joining us, and Paul, over to you.
Thanks, Jim. Appreciate the intro. So today, here's our agenda. It's very full. I wanted to start with giving you some of the data that the Veterans Benefits Administration basically tracks as far as how many veterans are receiving benefits. Then I'll talk a little bit about the general VA disability claims, that questions that we receive on a daily basis at our email vso@moaa.org. We also always recommend that if you are dealing with the VA for benefits claims, that you always use and engage a veteran service organization to ensure that you get the claim right the first time. I'll cover some of the changes that came about with the Appeals Modernization Act that went into effect in February. We'll talk about VA healthcare and the updated Mission Act, which replaced the Choices Act. Talk about the Blue Water implementation that's going to start giving benefits starting next month. Forever GI Bill changes, an update on Arlington National Cemetery, and the vocational rehabilitation and employment programs modernization efforts that the VA is undergoing. Let's start with our VBA reports. You can find these reports typically weekly, and then they produce an annual report in the March timeframe for the previous year. So we don't have 2019's record. So the stuff that's updated weekly, I'll show you the latest, but the future benefits is not going to be available. So we only have 18's data. So you can see here your pending claims. These are the claims that are VA disability claims that are in the system at VBA. So it's just under 400,000 claims. Now that has come down significantly from the significant backlog we had in the 2012 timeframe when we had almost 1 million claims that were in backlog. The backlog is considered anything that's over 100, the 125-day goal for completing a claim. So you can see we came down from 600,000 and we've been under 100,000 for the last few years. So the VA's modernization efforts in the VA, the disability claim arena, has significantly improved how fast the VA can complete a claim. So what's the average time? I told you that the VA's goal for a fully developed claim is 125 days. So right now they're taking under that time frame. They're taking only 95.9 days to complete a fully developed claim. For non-fully developed claim, they're taking about another week. What's the difference? A fully developed claim means you send everything into the VA at the submission. Okay, when you submit your claim, it's fully developed. It's got all the things in there that the VA needs to be able to adjudicate your claim. Let's see some of the other areas that the VA, VBA assists members in. So in 2018, they completed over 5 million claims, okay, by the end of that fiscal year. Pension is for indigent veterans, and they handled just under 500,000 of those. Fiduciary veterans, that's just under 200,000. Those are veterans who can't manage their own money, and they need a fiduciary to take care of their VA benefits. There's almost 900,000 veterans who are using their education benefits, and I've got some specifics on that in a future slide. Insurance under SGLI for active duty members and VGLI and other insurance are covered almost 6 million vets. The Home Loan Guarantee Program almost had just over 600,000 VA home loans in 2018. And then you can see the vocational rehab and employment. There's 125 veterans who participated in that program in 2018. So for compensation in 2018, as I said, they handled 306,000 claims. 275 of those claims were for veterans, and 31,000 were for survivors, with the average claim being about $12,407 for a veteran. And then the DIC, that represents the $1,300 that a surviving spouse gets. How is that worked? So basically the VA gives out disability in 10% increments, okay? I'll do a slide on VA math a little bit later, but they basically calculate your rating, and if you are at X4.9, they'll round it down to the lower 10%. If you're at 5.0 or higher, they'll round it up to the next 10%. So the rating is always going to be in a 10% increment from 0 to 100%. So you can see here about for the 2018 claims, about half of them, 47.9%, were the 50% or greater. If that person was a military retiree, they would be eligible for CRDP, concurrent receipt of disability pay. You have to be a 20-year veteran and have a rating of 50% or greater to get concurrent receipt. Okay. What are the totals for all compensation? You can see there the 50% or greater is about 55% for all veterans. And there are 4,700,000 who are receiving compensation from the VA. Excuse me. The new compensation, you can see here the age groups. For the most part, the veterans are between age 35 or 34 to 54 is the majority of the group, and you can see what the average is. So there's 275,000. That was for 2018, and then the total number receiving benefits of almost 76 billion or $77 billion is 4.7 million veterans. And again, there's a rehash again. So if you include the 4.7 million veterans plus 422,000 survivors, there's almost 2 million recipients of compensation. There's your education outlay. As you can see, as the Montgomery GI Bill ages out, most of the 900,000 recipients in VA education benefits are for the post 9/11 GI Bill, and that can be the veteran, the spouse, or children who have had the benefit transferred to them. So the VA's outlay of almost $12 billion a year in education benefits. Vocational rehab and employment, this is something that the VA is modernizing, but they also are trying to get out the word. Not enough veterans know, they don't spend enough time in the TAP class to discuss what VRE can do for you. Basically, if your disabilities are such that the skills that you learned in the military can't be transferred to a civilian position, the VA's VRE program will re-educate you, get you a degree or get you training to get you into another field, okay? So 113 applicants, 110,000 were eligible, and in 2018, 125,000 actually were in the program itself. Insurance programs, again, the VGLI, but the VA actually administers the SGLI program for the 2.2 million active duty and reserves. So, and you can see the VGLI, the program for veterans leaving service, if they have VA disabilities, they don't need to have a medical clearance as long as they purchase the VGLI insurance prior to 240 days of leaving service. Okay. After 240 days, the VA will require you to take a medical exam to qualify for that insurance, and you can get up to $400,000 under that program, just like you did in SGLI. Here's the home loan guarantee, $610,000 out in 2018, covering $161 billion. So the average loan amount was just under $265,000. Okay, let's transition now to general claims information. This is the stuff that we get on a daily basis. MOAA is no longer actively completing claims. However, we still provide information and advice for those folks who have questions about how the VA disability compensation and appeal processes work. Anyone, you don't have to be a member, anyone can email a VA disability claim or appeal question to vso@moaa.org, and I'll do my best to get you the correct answer or point you in the right direction. We get asked a lot about, hey, I completed a claim about 10 years ago, but now, this disability, my leg, my knee, my back, or my hearing has gotten worse. What do I have to do? Well, that's called a claim for increase. When you received your original VA disability compensation letter, they told you what they service connected you for, and then they'll tell you what the compensation level was, and they'll describe what the compensation level for your disability for that one specific disability was, and then they'll tell you what the next highest rating is, if there is the next highest rating. So if you think you've reached that next highest rating or gotten worse, you can submit what's called a claim for increase. If you were denied a claim or a disability, you can submit what's called a supplemental claim. If you if you believe that you've got new evidence that should support service connection, that's a supplemental claim. So the forms that you need are the 526EZ for original claims, that's your first claim, and then claims for increase. And then if you're resubmitting a claim for something that was denied, that's the supplemental form, or the 0955. You need in-service evidence of an injury or disease for the VA to service connect, and that medical is called the medical nexus. So you have to have either direct service connection, or if you came into the service with a particular condition and your service aggravated that condition, the VA can service connect you for that. Also, if you have some condition that develops a secondary condition, those are secondary service connections, those also can be service connected. An example of that is, say you have a bad back, lower back issue, and then that leads to peripheral neuropathy in your extremities, say in your toes. That peripheral neuropathy can be service connected based on the service connection of your back. And then there's presumptive service connections. Those are for the Agent Orange exposure, the nuclear test exposure, Camp Lejeune water exposure. Those are presumptive. So if you develop one of the diseases that are on that presumptive list, those are automatically service connected. You must meet the as likely or not if there's a question. As likely or not is in your benefit. So if it's iffy on whether the thing happened in service, but you have a medical opinion that your doctor thinks it's least as likely as not that it developed, a year or 2 years after service, that it's service connected, that medical opinion will help you get that service connected. And again, it does not have to be combat, wartime, or training related to get a service connection. If you develop a disease in service, just the VA's view is that the hardships of service led to that service connection. And again, it has to be something that's chronic. Say if you break a bone in your body and the bone heals, that's not a service connectable disability. Now, if you had such a bad break that they had to put pins or rods into your bone, then that could be service connectable. Okay. Where can you get your service connected evidence? Those are in your service medical records. You can have a buddy write statements. When I was doing claims, I had individuals who had sleep apnea, but it wasn't diagnosed until after service. Well, they had buddies who wrote statements that said, I was in a tent or on a ship with this individual and he snored and I detected apneas. It could be for logbooks or safety reports that chronicle an accident or injury, or it could be letters from your family where you describe you had an issue. What can that VSO do for you? Well, first of all, they're going to be well trained in how to protect your personal information and your medical information. So you can feel pretty confident that those VSOs are going to protect your information. So they'll also have a case management system that helps them put together your claim a lot easier than if you did it individually. And they know all of the different forms that are required. So I mentioned the 526EZ. There are other forms that must go in to be a complete claim. So if you want to get your dependents, because you get additional compensation when you're rated at 30% or greater, then you get additional compensation for your spouse and any children. You need to have a separate form for that, to annotate that you're married and that you have children. So that VSO can help you with that. Then they're going to explain the service connection and how that rating system, how it goes from 0 to 100% and how it's rounded up or down, like I mentioned earlier. I'll do a slide. I'll talk about how the VA calculates what your rating is. And then you have the 0, 30, and 50% milestone. 0% is important because that's saying that you're service connected and you have a disability, but at that specific time, it was a non-compensable disability. However, as I mentioned earlier, if that disability should get worse in time, that service connection, even at 0%, is important because you can put in that claim for increase. The 30%, as I said, is for your spouse and children. When you're rated at 30% or higher, you get additional compensation for your dependents. And then the 50% milestone, which I mentioned earlier as well, for those who are 20-year retirees, you are then eligible for concurrent receipt of disability pay. Therefore, you don't have what's called the VA waiver. Whatever you receive in VA disability compensation at 40% or less deducted from your military retirement. Again, they'll ensure your claim is complete, and they'll look at your medical records and give you an opinion on what you should be claiming, what's service connectable and what is not. If you didn't get your medical records or you've lost them since you retired, you can go to the National Archives submitting a standard form 180 or going online to the National Archives link that I have there and request a copy of your medical records. Be advised though, it's probably going to take you 6 months or longer before they're going to get them to you. So VA math, how does the VAs work? My example here is I'm going to say that we have 3 disabilities, a lower back strain at 30%, a right shoulder strain at 10%, and the tinnitus the ringing in the ears of 10%. The VA only considers that you have a 100% able-bodied once. So what they do is they take the highest rating, that 30% rating, and that goes against a 100% rated body. Therefore, you get the full 30% for that disability. Then they take the next highest rating, which is 10%, but that's only going to be evaluated against a 70% able-bodied, the 100% minus 30. So that rating only adds up to 7% for that disability, or adds to your combined rating. Then the final one, 10%, is against 63%. Then you add them all up. This is the long way to do it. There are shorter ways to do it. So that adds up to 43.3. Remember, as I said, if it was 44.9 or below, then it rounds down to 40%. There also is a thing called bilateral factors that can sometimes kick you up to the next highest rating level. So if you have a disability that's in both joints, say both hips, both knees, both shoulders, both elbows, because you're having it on both sides of your body, they'll add a percentage. Typically it's 1 to 3% to your factor, and that could kick you up. So if you had a bilateral factor here on this one and it kicked you up 1.7%, that would have taken you to a 50% rating. Who are the VSOs that are out there? Well, if you Google the VA Form 2122, that's the power of attorney. It's allowing someone to represent you. On page 3 of that form, it's a 4-page form, lists the nationally accredited veteran service organizations. I've put up the logos for a handful of them there. People ask, who does MOAA recommend? And we don't recommend any one particular VSO over another, because all of these organizations are national. And so in one location, they may be better trained because they've been there longer than in another area. So we don't necessarily pick one over the other. There is also what's called the county VSO program. Sometimes the county VSOs are more experienced than maybe one of the national organizations, because the county's folks may have been there for a longer period of time. So to find a county VSO, if your state actually does this, just Google your state's Department of Veteran Services, and it will take you to their website to see if they have a county VSO program near you. There is no cost. The VSOs should not be charging you for these services. They do it out of the goodness of their hearts, because they want to provide this service to folks. The only time you really need to pay for it is if you're going to go before the Court of Appeals, the final appeal process. Then you're probably going to want to find a lawyer, and you're going to have to pay that lawyer. Some do it pro bono, but typically you're going to have to pay for a lawyer. So your claims and your initial appeals, you do not need to go find somebody. You'll see advertisements out there for folks who say, I can get you 100%. Well, it doesn't come at no charge. Those folks they usually take a percentage of your first year's total disability check from the VA. So just buyer beware. Okay, in 2017, the president signed the Appeals Modernization Act. We went through a couple of years of trying to get rid of the legacy program, and they had a program called RAMP to try to ease into the new system. The new system went into effect in February of this year, and the new appeal process, you have 3 options basically. You can do a supplemental claim. A supplemental claim means that you're adding new evidence to to the claim that was denied. That will go back to the regional office where it was originally decided. The goal to complete those is 125 days. Then there's a higher level review that's using the same evidence, but it's going to go to a more senior rating official in that regional office. You can't submit any new evidence with a higher level review, but you can ask to speak with the reviewer to give them additional information that you think is pertinent over the phone, and sort of to plead your case. The goal for that is 125 days as well. Over the first 6 months of implementation of the new process here, of those 2 options that go to the regional office that decided your original claim, they are doing a lot better than the 125 days. So the previous initial appeal was called a notice of disagreement. That was taking anywhere from 2 to 4 years. You're now getting an answer within 4 months of your appeal. The final option, and a lot of veterans choose this or have been choosing this option because they don't want the appeal to go back to the regional office that made the decision. They're maybe not trusting of that regional office, but you can go directly to the Board of Appeal, which was previously the second level of appeal. You had to go to the regional office first, and then you could go to the board. The goal for this is about a year. Previously, when it went to the board, you weren't getting an answer until the 5 to 6, 7 year mark. So the Board of Appeals has hired a new bunch of judges and staff, and so they believe they are better able and should be able to meet that 1 year goal. I haven't seen the statistics yet on how they're doing so far. For those who didn't opt into the RAMP program, Rapid Appeals Management Process, there still was about 160,000 legacy appeals. The VA believes that they will finish and complete all of those appeals by the end of 2021. So they are making progress. Okay. VA healthcare. Get questions about this from some of our members that never filed a VA disability compensation claim, and then as they're getting older, they decide, hey, I want to be able to use VA healthcare. Well, if you didn't do a VA disability compensation claim, the VA is then going to do a needs assessment on you, which is basically they're going to ask how much money you make. Most of our members, retired officers, make much more than the poverty level, and therefore you're classified as a priority group 8. The VA stopped seeing priority group 8 to save money back in the late 90s, early 2000s. So unless you submit a VA disability compensation claim, they're going to do a needs assessment, and most likely you're going to be, unless you are indigent, you are going to not be able to have access to VA healthcare. If you did submit a VA disability compensation claim and were adjudicated with at least one disability at 0%, you can get into the VA system. You have to enroll. It's VA Form 1010EZ. Based on your disability rating, they'll put you into a priority group. If you're rated at 50% or higher, you are priority group 1. And then all of your medical needs will be met by the VA and at no cost. Now, for retirees, we get asked, hey, can I use both VA and TRICARE? Or if I'm in Medicare and TRICARE for life, can I use VA and Medicare TRICARE for life? Yes, it's your option. I know people who are still working who have an employer provided healthcare plan. They have a VA disability rating, so they enrolled in VA healthcare, and then they have their retiree TRICARE, and they use different medical sources for different things. So depending on if they had VA disabilities, they want to go to the VA for that type of care. If you are at 30 or 40%, that's priority group 2. Typically, all of those service-connected disabilities and care for those disabilities will be handled at no charge to the veteran. Other medical care that you may need, you may have to pay a copay associated with those. Okay. There is a combat veteran exception. The VA will provide 5 years of no-cost health care for veterans who enroll if they've served in a theater of combat operations. Okay. Hearing aids is always a big issue as well for veterans. Medicare and TRICARE for life and TRICARE for retirees do not cover the cost of hearing aids. Okay, hearing aids are very expensive, cost about $3,000 to $4,000 for each hearing aid. But the VA program, if you are in the VA healthcare system and you need hearing aids, you should be able to get them through the VA. And again, if you're priority group 1, they'll be at no cost. The Mission Act. So the previous care outside of the VA system was called the Choice Act. Okay, the replacement is the Mission Act. Went into effect of June of this year. This is a huge undertaking, and it will take multiple years before all of the requirements that Congress laid out in the Mission Act are going to be able to be implemented. One of the biggest issues for the VA is their IT problems. They've got system upon system for each program that they have, and then they've got to have patches for them to crosstalk. I was at a VA meeting last week, and they showed us how the education benefit is adjudicated for those who are applying for the post 9/11 GI Bill, and it was unbelievable the amount of different systems that the rating of the qualifier had to switch back and forth between just to approve a forever GI Bill. So the IT issues for the Mission Act are going to be humongous. And so it's going to be a multi-year effort to get all of these implemented. And MOAA is very active in monitoring the status of all these new programs. So the issue for a lot of folks is the expanded community care aspect of the Mission Act, or the replacement to the choice. You basically have to get approved. You have to enroll in the VA healthcare. You have to be eligible and enrolled in the VA healthcare. And then that local manager, program manager for you, your individual program manager, will determine what aspects of the community care you can participate in. Typically, it's if the care for that particular disability that you have, or the healthcare need that you have, is not available at the closest medical facility. Or if you live in a state or territory that doesn't have full service medical facilities, like Alaska or New Hampshire or Guam. If you are already grandfathered in as being under the choice program, you'll be accepted into the Mission Care Act, community care. And the VA, if they can't provide care within certain access standards, both a drive time or specific wait dates. So typically it's 30 minutes, and they have a program that determines how long your drive time would be to that VA facility. So it's typically 30 minutes for primary care and mental health issues, or 60 minutes for specialty care. And then if the wait time is 20 days for that primary and mental health, or 28 days for specialty care, then that can get you pushed into the community care program. Or if your clinician decides with you that it's best that you be going out into the community care, but again, your clinician has to agree with that as well. Or if they don't believe that the service line is providing to a care that the VA considers the standard level of care. Starting October 1st, the Family Caregiver Program was laid out. Currently, this Family Caregiver Program is only available to caregivers who are helping veterans who were disabled after 9/11. Okay, they won't expand to those other caregivers at least until the summer of 2020. And the twist on this is because, again, the IT issues of getting all of that done and out into the system. Okay, the Blue Water Navy program, we've put a lot out on this in the last basically year. It started out with the Supreme Court agreeing with Procopio versus the VA, or Secretary Wilkie, and saying that the Blue Water veterans should be included in the Agent Orange presumptive program. So the Congress, after the Justice Department decided that they weren't going to appeal the decision, the Congress passed Public Law 11623, the Blue Water Navy Veterans Act, directing the VA to include any ships that had served inside the 12 miles territorial waters of Vietnam to be included in the presumptive program. We waited all summer to get the VA's Office of General Counsel to publish the policies and procedures. They tell us that they are ready to go, that they will start adjudicating claims after the stay that was given in the law. The Congress put into that law, the Blue Water Navy Act, that the VA could delay 6 months to be able to get their act together and to start adjudicating claims after January 1st. They have been doing pre-development on claims. There was, as of June, there was already 5,000 claims that were Blue Water Navy claims in the system. Back in August, they let a contract. They've got all of the deck logs from the nearly 800 ships that we believe were inside the 12 nautical miles. So they got from the archives, and they let a contract to scan all of those records. And then they also let a contract with a tool that will take a look at the fixes that the ships logged in their deck logs and see if that fix put them inside the 12 nautical miles. Then they just have to verify that the veteran was assigned to that ship, that Blue Water Navy ship, during the time that they went inside 12 nautical miles. So it's a big undertaking to get this, but they do believe they're going to start adjudicating claims starting January 1st. I told you they did pre-development on some claims, so they were going to start doing the compensation and pension exams that are required with every VA disability claim, started in October and November, so that they would have the medical exams in hand so that they could start adjudicating those claims in January. They were going to take a look at retroactive dates for previously denied claims. They haven't announced yet how many of those they will do. Many of the veteran service organizations, when we were meeting with Dr. Lawrence from VBA, the Undersecretary for Benefits, was what if those Blue Water vets who are sick already, are they going to have access to VHA, VA healthcare? And we were told yes, that nobody would have been turned away or had been turned away. And I have not heard of any veteran who stated they were a Blue Water Navy veteran of being turned away from VA healthcare. And again, we've been waiting almost a year now on a VHA decision whether they're going to add 3 additional AO diseases to the AO presumptive, and those included bladder cancer, Parkinson's-like symptoms, and hypothyroidism. They were the VHA Undersecretary, Dr. Stone, testified before Congress back in March and said they would have a decision hopefully within 90 days. Well, 90 days has come and gone, and we still haven't gotten a decision. And MOAA has asked on numerous occasions to get an answer, and so far we still have not gotten an answer out of VHA on when they're going to add these 3 diseases. Forever GI Bill came into effect in 2017 and with a number of different years or different dates associated with implementation. So the major provision right away was anybody who left service and qualified for the GI Bill after January 1st of 2013, their benefits would never expire. If you left service prior to 2013, then you still have a 15-year expiration on your GI Bill benefits. They've expanded for those who with Purple Hearts can get the full 100% of the benefit. They're going to expand yellow ribbon benefits to include active duty and their spouses who currently can't get yellow ribbon benefits. The yellow ribbon benefit is for private schools that have tuition and expenses over and above the $24,000 limit for annual benefits. They've got 2 programs for science and technology, STEM and Vet Tech, that are being started this year, that went into effect this year. So if for folks who are in those science and technology fields can get an extra year of benefits if they qualify. Those who use their benefits on schools that shut down got some of those benefits restored. The calculation was changed to make it fair for everybody. And then also the monthly housing allowance, which also had a big glitch. Basically, the law, the new act, told the VA that they had to pay the monthly housing allowance based on where the students spend the majority of their time. There are a number of examples of extension campuses that are in a different area, a much lower cost area. I can think of one is Columbia University. They have a campus in Manhattan where the monthly housing allowance is over $4,000, and then they have a campus on Staten Island where the benefit is about $2,500. So whichever the student goes to campus they go to for the majority of their time, that's the monthly housing allowance that the VA was ordered to pay them. They rushed into service an IT contract that would calculate this, and unfortunately the program failed. So they just now had the fix. They took about a year, and they just fixed It rolled out on December 1st, and the program works. So they're now paying students what they're supposed to be getting. Reservists who are recovering from duties that they suffered on active duty will get additional time to be able to go to use their benefit. Let's see, expanding of transfer. So say if a child had the benefit transferred to a child and that the child passes away before they can use the benefit, and the veteran has already left service, you can add now additional or move that benefit to somebody else. And the same thing if the veteran passes, the survivors can move those benefits. They increased school certifying training to make sure that individual institutions knew how to apply the benefits for their students. DoD proposed last year that anybody after 16 years of service would not be able to transfer the benefit. That was supposed to go into effect this July, this July 12th. Congress, enough MSOs and VSOs appealed to Congress to say that this was not fair to the service members, and so DoD delayed the implementation of the transfer of the benefits until January of 2020. I was just told yesterday that the draft NDAA forbids the DoD from implementing that exclusion of being able to transfer the benefit after 16 years. So that's another good news story. So as long as you can continue to serve your 4 years, you can transfer the benefit after 16 years of service. Memorial benefits, we get questions on this, and the next slide is actually the one that's probably more concerning for many of our listeners today. But there are 135 national cemeteries throughout the country. If you serve for 3 years, you are entitled to at no cost for the grave site, the headstone, a liner. You can call the National Scheduling Office and see and get yourself pre-approved by submitting that form and submitting it to the National Scheduling Office. The only thing that you need or is required is a DD 214. If you're a reservist, you just need to show them your point schedule. So Arlington National Cemetery. The Secretary of the Army was tasked by Congress to come up with a way of extending the life of Arlington National Cemetery past the scheduled 2045 timeframe when they believed they were going to run out of burial space, interment space. Over 200,000 veterans answered the Army's survey. The majority of, or the theme was that they felt that they should expand where possible, and there is not a lot of area to expand around. They're going to expand by the new Air Force Memorial, but they acknowledge that they may have to limit eligibility when necessary. The Army just came out with their proposal. It would limit internments to active duty combat deaths, Medal of Honor winners, prisoners of war, and those who are awarded service crosses, silver stars, or purple hearts. So that would get severely decrease the number of individuals who are going to qualify for interment or burial. So this has been a topic that many of the MSOs have brought to Congress, asking for a better explanation or more data from the Secretary of the Army. It has gone to the Federal Register. It will be posted sometime in the springtime, and veterans will be able to make comments on the proposal, whether you think it's a good idea or whether you disagree with it. Should they grandfather in previous war veterans like World War II veterans, Korea veterans, Vietnam veterans, Gulf War veterans, or not? So stay tuned for more information on this, and MOAA updates this rather continuously on our website. Okay, I talked about VRE, Vocational Rehab and Employment Modernization Plan. They were very much stuck in 60s computer system, and they did not have enough counselors, and their counselors were basically spending more time on their administrative tasks than meeting with veterans and folks who are in the program. So they're moving from a paper-based program to electronics records to be able to speed up service. There is some connotation that the vocational rehab that may have a negative connotation to some veterans, and so they were looking at a name change, but it's still, as far as I know, it's called still vocational rehab. They want to expand the exposure of this program. They don't think enough veterans take advantage of the opportunity that VRE provides. These modernization efforts to reduce the administrative tasks, they see, as you see there on the slide, 60% of their time is spent on administrative tasks, which we'd much rather see them working with their veterans. They brought on 169 new counselors in the last year, so they've gotten their counselor to veteran ratio down to 1 to 125. It was like 1 to 200 previously. And then the surveys or a study that they conducted thinks they should get it down to 85, 1 to 85, but so far they haven't been approved to hire anything above the 169 that they've gotten. And then they're doing these technology reforms, like a lot of the VBA programs. They've got a new case management solution versus a system that they're putting into play, and they're using the Veterans Health Administration's Video Connect teleconferencing capability, so that they don't have to wait for a veteran to come in to get counseled, that they can do it over one of our smartphone systems. Okay, MOAA does these webinars monthly. Our next webinar will be in January 29th, and it will be a career transition webinar. And then in February, we'll do another finance and benefits webinar. We don't have those topics yet, but you can go to our website, www.moa.org, and you can see there a screenshot. It shows the events tab, and that will take you to whatever the events that we're conducting in the near term. Please wait for the survey when you check out. And complete the survey and give us any ideas on what types of webinars you'd like to see us conduct. Now I'll go ahead and take a look at the questions that you all have submitted. Okay. Okay, when do you anticipate making a decision on new presumptive Agent Orange illnesses? As I said, we've been asking that continuously of the VA, and we've not gotten an answer. But I believe now that Congress has passed, or the conference has passed the NDAA, and we're just waiting on the full Congress to vote on it. I believe once we've gotten that out of the way, I think they'll be able to focus on this issue and ask the VHA to come back and give them a determination. Okay, asking if we get a copy of the presentation. As I said on the first slide, we don't hand out the slides, but you have the opportunity, if you registered for this event, within about 5 business days, you will receive an email to the email that you registered under with a link to the recording, so you can watch the recording at your leisure, stop and start it, and if you have the capability of printing it out from a YouTube video, you can do that. But we do not email out the slides. Have stopped via confiscation actions on fiduciary weapons that was initiated under Obama. Has the VA stopped weapons confiscation? That I am not sure of. Typically, though, if you are in a fiduciary state where you need to have a fiduciary, they will not continue to give you benefits if you have a registered weapon unless you turn that weapon in. That was my understanding. I have not heard of any change to that policy. What is concurrent receipt? Concurrent receipt is when you are eligible You have a retired pay. You've done 20 years of service. Medical retirees don't qualify for concurrent receipt because if they have less than 20 years of service. And you have a VA disability compensation claim. If you are 50% or greater, 50, 60, 70% greater, then you get to keep your full retired pay. For those of us who are rated 40% as a retiree, I have my VA disability compensation deducted from my retired pay. We always recommend that the veteran go ahead and take the VA disability because that's tax-free, whereas your retired pay is taxable. Any status on the current House bill that addresses, sorry, let me expand this here. I can't, okay. Are heart attacks and or strokes considered aggravating circumstances for either higher blood pressure? Yes, I actually won an appeal. I had a client, via a veteran, who had high cholesterol while in service, and it was documented in his service records. And then the individual had a heart attack about 6 years after service. I made the argument to the VA that high cholesterol led to a heart attack. And initially it was denied. We appealed that decision and we were able to get it approved so that he ended up getting compensation for that heart attack after service. Who can I get to help me with a VA disability claim? As I mentioned in the brief, if you go Google the VA Form 21-22, you can see the list of nationally accredited organizations, or you can Google American Legion or DAV, Disabled American Vets, Vietnam Vets, and find the closest one in your area. You could also see if your state has a county VSO program. So if you Google your state's Department of Veteran Services, you can see if there's a county VSO program. You need to contact any of those agencies and make an appointment to come in and do a VA compensation claim. Can the VSO tell me what documentation is needed to support a supplemental claim? Yes, they can. They are certified by or accredited by the VA to tell you the different types of documents that or VA forms that are required to complete a proper claim. If I am retired and on Medicare and TRICARE, am I eligible for VA medical benefits? As I mentioned in the brief, if you have a VA disability compensation claim that's been adjudicated at least one disability at 0%, then yes, you can enroll in VA healthcare. You need to submit a VA Form 1010EZ to enroll. Is there a way to find out what educational benefits you have remaining? Yes. Basically, you need to go to the VA's website, and then look at how to apply for VA benefits. There is a section on their website, how to apply for benefits. Once you apply for benefits, they will send you a letter back stating what benefits you have left or if they have expired. If you've gone for the Montgomery GI Bill, if you've gone greater than 10 years, for the post 9/11 GI Bill, if you've gone greater than 15. How do I know what my priority group is? If I have a higher than 50% disability, am I priority group 1? Yes. If you are 50% or higher, you are a priority group 1, but you still have to enroll in VA healthcare to be assigned to your priority group. For service connection, just remember that your VA healthcare is only for that condition. You would not be able to, I can't read the rest. Again, if depending on your priority group, if you are a priority group 1, everything, whether it's service connected or not, is covered by the VA. If you're less than that, then it will depend on the disability or the healthcare need that you have and whether you have co-pays or not. Can retired officers get VA health care at all? As I mentioned, if you have a VA disability compensation claim, that will determine your priority group. If you don't have a VA disability compensation claim, you are going to be evaluated based on need, what your income is. And typically retired officers, they're going to be above the poverty level and therefore will be priority group 8. Okay, if you're above 65 and on Medicare, Parts A and B with TRICARE for Life, you can choose VA versus A and B. Yes, you can strictly go to VA healthcare and opt out of Medicare Part A and B. If you don't pay for Part B, you don't get TRICARE for Life. And every year after age 65 that you are not enrolled in Medicare Part B, you have a 10% penalty. So if in the future you decide you don't want to use VA healthcare, but you didn't pay for or enroll in Medicare Part B, there's a 10% penalty for each year that you are out of the program. Does VA make your disability pay retroactive if you were denied an obvious claim and you reapply years later? No. If you meet all of the timing requirements. So if your appeal is submitted within 1 year of your notification letter and you keep in the program, you meet all the timelines, then yes, it will go back. But if you go past the 1 year appeal timing, then no. And then you submit a claim again and then it's approved, no, they will not. You have to stick to the timelines that are set for each of the appeals to be able to get that retro pay back to the original claim. Do children get these Forever GI Bill benefits if it was transferred to them and they have not yet started using STEM? Again, that's a separate issue. You have to start using the benefits, be in the program before you can apply for STEM and get the additional year. So if they haven't started yet, they just have to wait until they get into a STEM program and then apply for STEM once they're using their GI Bill benefit. What is the status of concurrent receipt legislation? There are bills for those that are 40% or less and for medical retirees that are on the Hill every year, but there's been no movement on those for the last 3 years. Last 2 years. 2 years ago, MOAA made an effort to try to get medical retirees approved for concurrent receipt. We took a look at the numbers. There are 210,000 medical retirees that are on the books. 190,000 of them are enlisted. Of those 190,000, majority have VA ratings of 50, 60, 70%, and had 15, 16 years of service. And they were basically having their entire medical retirement wiped out by the VA waiver. So we thought, hey, we'd always kept the two groups together, the medical retirees and those who are 40% or less with 20 years or more of service. We'd always kept them together. Well, we thought, let's see if we can get this hard hit group across the finish line, and then we might be able to tackle the remainder, which is about 400,000 who are 40%, 20-year retirees, 40% or less. We thought it started okay. It started out with a lot of support, and then it just never got across the finish line because the congressional reps thought it was too expensive. Am I required to have used the VA health system only to be qualified for increased disability rating? No, there is no requirement with your VA disability compensation claim. There is no requirement to use the VA healthcare system. If you have employer provided healthcare, if you have TRICARE as a retiree, or if you're in Medicare TRICARE for Life, there is no requirement to use the VA healthcare system. I just found out that my medical records were lost when I was servicing. You have a recommendation. I would still check with the archives, as I mentioned on the screen. Either go online and see if they found them. If it was lost at the last medical treatment facility, military treatment facility that you were at, but then they were found later and you were no longer in the area, they should have still sent them into the archives. So I would recommend that you check with the archives anyway to see if somehow they made their way to the archives. Are there any presumptive medical conditions for Desert Storm, Desert Shield? They have started a burn pit registry. They are starting to adjudicate for respiratory issues from exposure to burn pits, but there is no presumptive condition that if you served over there, that you're automatically presumed covered for any particular decision one way or the other. Are we ever going to get dental assistant at VA medical centers? No. They do have certain veterans can get dental care at VA medical centers, but it depends on the conditions. I've reached my time limit. We truly appreciate you participating in today's webinar. Please tune in next time and have a great holiday season. Take care.